I use regenerative medicine literally every single day. And it can be from very basic things like you were just saying, from wound healing. That's a whole nother incredible topic, where you can take recalcitrant wounds, or not even recalcitrant wounds, just new wounds, and expedite their process. And there's ways to do that with, matrices and fibrin and PRP, all kinds of things. So there's that aspect. Then there's the true regenerative aspect from, like I just said, even hair restoration, which has a really broad and wide application there, all the way through post-surgical recovery, post-procedural recovery, whether that is like a non-ablative laser or an ablative laser or a surgery. And that's where it really, really starts to show its benefit, is in those types of kind of the more change that there is to have, the more that regenerative medicine can really shine in what it does. And, there it's a question of, are we talking about improved results? Are we talking about decreased downtime? And, in my practice, it's a combination of the two, really. We all know that with most of our procedures, there's a very direct relationship with what we're doing and what their downtime is going to be. And so one of our objectives is to use regenerative medicine to decouple that very direct relationship a little bit and decrease downtime while still being able to be as aggressive, or kind of get those same surgical results that we may be after. And if we can, let's say it's an ablative resurfacing or a surgery, we can improve the results that we're getting at the same time that we're decoupling the downtime, even better. Like we just talked about PRP, there's a lot of variability around that. And that's a super simple place to start, because you can get an off-the-shelf kit that, makes things very simple, very low touch for staff. And, the quality of the PRP you get from there is going to be variable, versus, as you probably get better at it or get more comfortable with it, sort of manipulating that PRP to get higher platelet concentrations for different types of things. That's a super simple place to start. And then that can evolve into now changing that PRP or PRF into like a matrices or something you might use for like a wound healing case. And we all have those in our practice, whether we're reconstructive or cosmetic. We're all going to have wounds that need help healing. And then you can get into things like, if you're comfortable with regular fat transfer, it's like, okay, well, now what can you do to maybe increase the stem cell content of the fat you're using purposefully? And there's lots of papers and publications about this. And this is where I get into in vitro versus, real life. But we know that we can take these things that we already have at our fingertips and just sort of, I think, be more purposeful with them in ways that we could, kind of use them to augment our practice. I'm not saying that everybody should get a hyperbaric chamber in their practice, but I'm also, it's worth trying with some of your patients who are amenable to it. And, I find that in my practice, it's wildly popular. I actually encourage, not that I don't give options, but I encourage people, like, this is part of their procedural pricing and packaging, is that these things are included. Please use them, type of thing. If they don't want to, no problem. Their price doesn't change, but it is, it's here and it's at their fingertips. And so just kind of going at it with that instead of like, it's an add-on to what they're doing. In reality, doing PRP or stem cells with a procedure that you're already doing is very low touch, very low extra effort, time, energy on your staff's end. It's really just kind of getting more comfortable with them over time, and building them into your practice is just part of sort of who you are. And again, you have to be interested and passionate about these things, but the benefit is real.